First of all, I'm glad to be here with you this morning for the opening of this training program. And on behalf of the Fijian government, I also want to wish our resource personnel a very warm welcome to Fiji and Bulavinak for coming to Fiji. Big Bulavinak to all the participants that Dr. Dikamatana has mentioned, where you're coming from, our social partners, our Ministry of Health, academia, community health workers. I didn't realize that there'd also be community health workers here, so I'm glad to see that you're all here. Last Friday, we commemorated the World Day for Safety and Health at Work with the theme Optimize the Collection and Use of OSH Data. On the very same afternoon, we jointly launched Fiji's first ever Occupational Health and Safety and Occupational Health Sepsis Profile, which was a historic moment for Fiji in that our name can now be recognized on the global stage in relation to where we are in terms of OHS. During the launch last Friday, I had acknowledged Dr. Jone and Dr. Rako Kim, together with a team from WHO, the ILO, the Ministry of Health and Medical Services, FNU, USP, and staff from my ministry, from completing the profile in time to coincide with World OHS Day. So congratulations to all of those people that were responsible for that. I had also stated in my opening remarks last Friday that optimizing the collection and use of OH data is an area that will need the collaboration of all stakeholders, and the launching of our profile is just the beginning for all our stakeholders to start working closely with each other on a more regular basis. ILO has estimated that over 2.3 million fatalities occur as a result of occupational accidents and diseases, while 300 million accidents occur in the workplace each year. However, these estimates do not properly reflect the magnitude of the problem, nor the real impact of occupational accidents and diseases on workers, families, the communities, and economies. Occupational hygiene uses science and engineering to prevent ill health caused by the environment in which people work. It helps employers and employees to understand the risks and to improve working conditions and working practices. Occupational hygiene is preventing ill health from work activities. Occupational hygiene practitioners come from varied backgrounds. They can be chemists, engineers, biologists, physicists, doctors, nurses, and other professionals, all of whom have chosen to apply their skills to protecting the health of workers. It is a multidisciplinary, so practitioners must acquire a broad and solid foundation of knowledge across all these disciplines and more. Common to all practitioners is a core of knowledge that can only be described as occupational hygiene and a strategic approach to managing health hazards at work and also in the community. Inspectors such as you need good training because you have to deal with a wide range of disciplines, from risk engineering, occupational hygiene, hazardous chemicals, risk management, ergonomics, workers' compensation, occupational medicine, and their applications in law. Good occupational hygiene practice benefits workers and employees alike, which results in improved worker health and increased life expectancy. And that's something we all want. Reduction in the number of people who have to leave employment early through injury or illness, lower social and healthcare costs, as well as maximizing worker potential, and more efficient working processes with technological improvements and increased productivity. With good understanding of occupational hygiene practices, risks can be reduced or eliminated and others brought under control. This is one of the reasons why this training workshop is very important. With your training in the field of occupational hygiene, Fiji can expect to see more consistency or uniformity in the identification, the assessment and control of occupational hazards, with strategies being developed and implemented in workplaces and communities to minimize risks. I have already expressed my appreciation to all participants for being here, and I urge all of you to ensure that you keep yourselves up to date and keep getting regular training so that your knowledge remains current and relevant. You have a great opportunity before you through this training and with the knowledge and skills that you will acquire in this training. These developments offer us the opportunity to truly make a difference to the lives of the people in our community. With Fiji's varied resources, I believe that the launching of our first ever Occupational Health and Safety and Occupational Health and Sepsis Profile last week will continue to provide more opportunities for Fiji in building our capacities on human resources and also on opportunities in terms of technical and monetary assistance from our international partner. This Occupational Health services and hygiene training will help to build the capacity of Fiji's OHS practitioners in the detection of new hazards, emerging risks, the identification of hazardous sectors, developing of preventive measures, as well as the implementation of policies, systems and programs at the enterprise community and also at national level. I believe that this training is funded by the World Health Organization is a testament of more closer working relations and more similar trainings to come in the near future. Now that I've read all the prepared speech, and I've also begun to sweat again this morning, I'd just like to say that I think this training is very important because for me and for my ministry, it's a matter of productivity. I think the most critical element in any country is the health of its workers. In terms of productivity, I always talk about productivity as being productivity. The very heart of productivity is people themselves. And in this country, we have been investing a lot of money into the quality of our workforce. That has been reflected by the vast amounts of money that government has put into education. Over the past few years, you will have seen that government has invested into early childhood education, into secondary education, and to tertiary education. But one thing that I know that is always lacking, and that is looking at the quality of the workforce in terms of their health. Last week in Parliament, was it last week in Parliament or the week before? Last week, man, time flies. You tend to forget what happens last week when you start losing your hair like this. But last week in Parliament, we were debating this issue. That's why I'm particularly glad that this is happening, because ever since coming back to this Ministry of Employment, since my stint with the lovely people at the Health, who taught me a lot about health, I've come to realize the importance of this. So I'm very, very grateful. Thank you to WHO, and thank you for our speakers for being here. You, all the people in this room, we will look to you to spread the gospel of what you learn. This knowledge that you acquire must not be something that you just keep in cold storage. It must be reflected in something that you choose to do wherever that you're working. If you're in academia, it has to be taught to people that you teach. If you're in the ministry of my ministry, I expect you to take this knowledge and apply it to wherever you go. Not just in your workplaces, but everywhere you go, in your own communities, because we need our people to be healthy. If we have a healthy workforce, healthy spiritually, healthy mentally, healthy in every other way. When we have that, it has an impact on our productivity as a country. And that's, as a minister, that's what I hope to be able to see that we can do this. So I'm looking to all of you. Let not this be something that you just come and attend a training program for 4 days. Let it be knowledge that you get, and then you take that knowledge and you apply it in the workplace. You apply it wherever you work, so you make a difference in the lives of the people that you serve. I always tell the people in my ministry, you're so fortunate to work in a ministry where you are paid to serve people, to do good by people. So the knowledge that you acquire in this program, you have that opportunity to be able to do that. Do good for the people that you serve, for the citizens of this country. So I wish you all success, and I see that we hope that we can continue to work in partnership for the betterment of the people of this country. Thank you, and God bless us all.
Thank you, Honourable Minister.